Welcome to the MD Edge Daily News for Monday, August 20th. I'm your host, Nick Andrews. Today, the effects that smoking and drinking have on systemic lupus erythematosus risk in black women. Also today, the FDA approves the first generic EpiPen, and later, 15-year data from the Veterans Affairs Diabetes Trial. But we begin today with a call to prepare for the coming tsunami of non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease, or NAFLD, is the 21st century epidemic in liver disease, according to Dr. Zobair Younossi, speaking at the annual meeting of the American College of Physicians in New Orleans. Dr. Younossi says that massive growth in the disease is being fueled by the related epidemics of obesity and type 2 diabetes. Indeed, nearly 75% of all patients with non-alcoholic fatty liver disease have type 2 diabetes. Dr. Younossi is a professor and the chairman in the Department of Medicine at Virginia Commonwealth University. He offered practical tips on how busy primary care physicians can identify patients in their practice who have a high risk for non-alcoholic fatty liver disease. He says that currently, primary care physicians have not done a good job of this, possibly due to a lack of incentive. He notes that currently there is no approved drug for the treatment of non-alcoholic steatohepatitis, which is the form of non-alcoholic fatty liver disease that has the strongest prognostic implications and can progress to cirrhosis, liver failure, or hepatocellular carcinoma. Dr. Younossi says that patients who have NASH deserve to know it because of its prognostic implications and so that they can have the chance to participate in one of the roughly 24 ongoing clinical trials. You can read more about the scope of the epidemic and practical ways to identify risk by clicking the link in the description. Black women who smoke cigarettes are at increased risk of systemic lupus erythematosus, while those who drink alcohol in moderation have a decreased risk. This is according to data from the retrospective Black Women's Health Study published in Arthritis Care and Research. The researchers report that current findings among black women are consistent with the previously reported positive association of cigarette smoking with the risk of SLE and inverse association of alcohol consumption with SLE. Black women are the demographic group at the highest risk for SLE in the U.S. In the study, researchers examined data from nearly 60,000 black women in the U.S. and found 127 new cases of SLE between 1995 and 2015. They reported that women who smoked had a 45% higher risk for SLE compared to those women who never smoked. These data did not achieve statistical significance. Researchers also reported that current and past alcohol consumption is associated with non-significant reductions in risk of SLE. However, moderate consumption of alcohol was associated with a decreased risk. Moderate alcohol consumption was defined as 4 or more drinks in a week. The researchers note that the associations between cigarette smoking and alcohol intake with SLE risk were biologically plausible and may lead to insights into SLE pathogenesis. The FDA has announced the approval of the first generic EpiPen and EpiPen Jr. autoinjector for the emergency treatment of allergic reactions, including anaphylaxis for adults and children who weigh more than 33 pounds. FDA Commissioner Dr. Scott Gottlieb says that the approval is part of the FDA's longstanding commitment to advance access to lower cost, safe, and effective generic alternative once patents and other exclusivities no longer prevent approval. The FDA has previously approved other epinephrine autoinjectors, which include brand name products and so-called authorized generic versions of EpiPen and Adrenaclick. The FDA defines a generic to be made under the brand name's existing drug application using the same formulation, process, and manufacturing facilities that are used by the brand name manufacturer. The labeling or packaging is changed to remove the brand name or other trade dress. In some cases, a company may choose to sell an authorized generic at a lower cost than the brand name drug product. Dr. Gottlieb explained that complex generics are those that include both a drug and a delivery device. He says that these items face a tougher path to approval because the FDA has to evaluate and approve both components. You can read more about FDA approval of a generic EpiPen by clicking the link in the description. And finally today, there is no legacy effect of intensive glucose-lowering therapy that was dissipated by year 15 for patients with type 2 diabetes in the Veterans Affairs Diabetes Trial. This is according to final results from the VADT follow-up presented at the 2018 annual scientific sessions of the American Diabetes Association in Orlando. In the study, researchers randomly assigned more than 1,700 patients with type 2 diabetes to receive either intensive glucose control or standard glucose control. The researchers report that the patients did not experience a significant improvement in the primary cardiovascular disease outcome after a median of 5.5 years of active treatment. At 10 years, interim data was published in the New England Journal of Medicine, which showed a delayed benefit in these outcomes among those in the intensive control group. At the 15-year follow-up, with the HbA1c levels similar across groups, nearly all benefits that were seen at 10 years were lost. The researchers also report that there were no significant differences seen at 15 years in the secondary outcomes. Dr. Peter Reaven is the director of the Diabetes Research Program at the Phoenix VA Healthcare System and is professor of clinical medicine at the University of Arizona in Phoenix. Dr. Reaven says that these results suggest that there are modest long-term cardiovascular disease benefits with therapies directed toward bringing glucose control to near normal range in high-risk type 2 diabetes, and that substantial and continuous glucose separation may be required to maintain these improvements. He also notes that recent studies which demonstrate cardiovascular benefit with diabetes agents that only achieve modest improvements in glycemic control highlight the importance of also considering non-glycemic approaches to reducing cardiovascular disease events and mortality in these patients. You can read more from this feature story, including clinical impact and trial design data, by clicking the link in the description. And that concludes the Monday edition of the MD Edge Daily News. The Daily News is available each and every weekday on Amazon Alexa, Apple Podcasts, Google Podcasts, and Spotify. For MD Edge, I'm Nick Andrews.